Hi, my name is Dr. Sunny Chang, and welcome to Maryland Vision Institute. We're going to talk about some of your cataract surgery options today. We put together this video to help educate our patients about the experience of cataract surgery and some common questions and concerns that they might have. A common question that people ask me is, how did I get this cataract? I tell patients that it's just part of the aging process and that you're actually fortunate to have cataracts because you actually got to that age. The only proven treatment for cataracts is cataract surgery. There's no eye drop or any other treatment to remove that cataract. Cataract surgery is the most common procedure performed in the world and the United States, and it is the most successful in terms of your recovery and visual result. I've been performing cataract surgery for about 15 years, and this is definitely the golden era of cataract surgery in terms of precision, patient recovery, patient comfort, and visual outcomes. There are many more choices today than there were many years ago, so we do want you to have the best information possible to make the best informed choice for your own situation. Unlike traditional cataract surgery, which is done all manually, the laser cataract system is mostly done by a computer that's extremely precise, which no human can replicate. We do recommend it for all patients if they can have it because nothing replicates the precision of the laser. The laser can very precisely create the incisions, create the opening to the cataract, and really soften up the cataract before removal. So that when we go in to remove the cataract, a lot of the work's already done for us. Less energy is expended to remove the cataract safely. I think most people are familiar with the concept of a laser being more precise than any human could ever be, especially in terms of regards to other types of eye surgery like LASIK. So the use of a laser and assistance with cataract surgery, I think, makes people feel better. There are two main types of lenses that help treat astigmatism. There's a toric multifocal lens, which gives you both near and far vision, as well as computer vision, and also neutralizes your astigmatism. And then there's a toric monofocal lens that'll just correct your astigmatism and give you great distance vision. Both types of lenses will help reduce your dependency on glasses, but especially the toric multifocal can help reduce your dependency at all distances. The majority of these lenses will give a much superior outcome in terms of your freedom from glasses compared to the traditional lenses that were available 10 or 15 years ago. After a thorough examination of your eyes, we determine what's the most appropriate lens that would fit your needs and also the dimensions of your eye. We always kind of recommend a specific lens for a patient based on what they've told us about their lifestyle and their visual needs. Medicare will only pay for a certain type of lens, a traditional monofocal lens. If you do want one of these more premium lenses that can free you from glasses, there's a small payment for that. The counselor will go over the details about the specific out-of-pocket costs and also give them more specifics about the different lens choices. The day before surgery, one of our nurses will give you a call to go over some of the last-minute instructions in terms of what drops you should be taking and also what to expect during the operation and some of the instructions for afterwards as well. We typically do the worst seeing eye first, and then we can do your second eye either 1 or 2 weeks later. So on the day of surgery, you'll first check in with our front desk staff about an hour before the surgery, just to fill out the paperwork and make sure that's in order. Then the nurses will bring you back to the preoperative area where they'll measure your vital signs, give you some eye drops to help dilate your pupils, and also start some sedation to get you more relaxed. The vast majority of your time here is before the operation and afterwards, waiting around. But the surgery itself is about 10 minutes long. We give you eye drops to basically numb the surface of your eye, and also a little bit of medication inside the eye without any needles. Our anesthesiologist will also give you some medication to help relax you, take the edge off the experience. It's mainly a feeling of pressure or maybe a little cool water here and there, but most patients, or many of them, are just sleeping through it as well. Afterwards, you go to our post-operative recovery area, have a few crackers and some juice, and then you go home probably about 10 to 15 minutes later. You'll need someone to drive you on the day of the operation and also to drive you home because you'll still be a little bit sedated afterwards. We see you approximately 2 or 3 times after your surgery to ensure the health of your eye. The first day is mainly to make sure that the intraocular pressure is normal. The vision is still going to be a little bit blurry, maybe a little scratchy, but after that it gets better with every passing day. Our operating center is only for eyes, and this is the only thing we do here, so that helps with the efficiency and the patient comfort and your experience here. Our goal is to provide a more concierge and very personal experience for your procedure. We have the top of the line equipment, staff, and I believe surgeons to help you take out your cataract safely. If you have questions about the procedure or any of the options, please let the surgeon know or one of our experienced counselors know. Also, many of our technicians are very experienced with the process as well. I consider it a privilege that patients and their families put their trust in me as a surgeon to help them see better and live a more fulfilling life. The studies have shown that cataract surgery decreases your fall risk, improves your longevity, improves your mood, and these are kind of logical reasons why people do better after cataract surgery. Patients should be very excited about having cataract surgery, not just because it can improve their vision, but also can improve the quality of their life.